Healthcare, I know you say you're liaising with the clinical commissioning group, but GP surgeries seem to be struggling with increased reliance on locums. The QA is almost at bursting point. What influence do you have there regarding improved provisions, and how do you expect the local healthcare to cope?
It's a very, very important point, and people do find it, I know, and I do myself, much, much harder to get appointments with GPs in a timely fashion. Even getting through to the surgery, I think, can be one of the first challenges for the really fit to keep at it and get through. But in the same way that we rely upon the utility providers to tell us what is needed so we can require it through the planning process, we have to rely on the health authorities to tell us what is needed so we can require it in the planning process. And the clinical commissioning group for Fareham and Gosport, they are our primary consultees that we need to talk to about healthcare, and they need to tell us whether the plans which the developers put forward are going to be adequate for them. And of course there are two elements to that. There's developers saying there's land for a health centre if somebody builds it, or if the developers are saying we're going to build a health centre, and of course that's part of the next phase, which is a planning application in detail for what goes on there. And then for the CCG to say, well, the health centre's got to be to this specification so that we would accept it. And also, of course, and it's the point you're majoring on, is the manning of it, and making sure that they've got the GPs trained so that they're going to want to take it on. I would imagine in the early days, certainly, that the medical care will come under the care of another practice anyway. It'll be a matter of whether they want to move into Welborne or whether the CCG needs to recruit, bearing in mind that GPs are not employed by the National Health Service. They are private business people running private businesses. They are contractors to the NHS, and whether it makes financial sense for them to open a practice in Welborne. So we work closely with the CCG, but they need to tell us what they need so we can make sure that as part of the planning process it is provided.